Hi everyone. So today we will talk about disorders in our immune system, disorders in immunity. There are two types of immune system disorders. The first one is called the underreactions. It means that our immune system is actually kind of lack of immunity, or maybe is not, is really weak kind of immune system. So this one is called the underreaction. The second one will be called as overreactions. In this case, our immune system especially is too sensitive. They are very, very sensitive against some of maybe antigens. And that's the reason why this overreaction is called as a hypersensitivity. Now, for the underreactions, there will be two types. The first one is lack of surveillance. In this case, the T cell is actually not surveying our body. And what will be happen if happening like this? Then many of our cell can do the uncontrolled cell division. Is called cancer. So most of the time, cancer is caused by lack of the surveillance. We have learned that the cell that survey our body, that control our body, to find something that is happening in the cell is actually the T cell. So when the T cell unable to perform their job, what happens? Our cell will be abnormal. It's going to be cancer development, for example. The second type of underreaction is called the loss of immunity or immunodeficiency. Okay, this is caused by maybe lack of the cell, maybe lack of the T cell, or maybe lack of the B cell, or maybe lack of both T and B cell. So this is called the immunodeficiency. There are two types of immunodeficiency, which is primary immunodeficiency and secondary immunodeficiency. So in the primary immunodeficiency, this person actually don't have the immune system during their development, and most of the time, they don't have the ability to protect themselves against the disease. And most of the time, the one that have this type of primary immunodeficiency, they will die during young age because they're unable to protect themselves against infection. The second type, the secondary immunodeficiency, it is actually acquired after we born. The famous example is AIDS. Say AIDS is a type of immunodeficiency. Now, for the overreactions, there are four types. Okay, it's called the type 1 hypersensitivity, and then it's type 2 hypersensitivity, and type 3 hypersensitivity, and type 4 hypersensitivity. The type 1, type 2, and type 3 is caused by antibodies. Okay, antibodies or the immunoglobulin. Remember, the antibodies is produced by the B cell. So B cell that produce the antibodies. Some of this antibody is really, really reactive and causing this type of hypersensitivity. For example, type 1 hypersensitivity, it is also known as an allergy. It is caused actually by the hypersensitivity or overreaction of the IgE. So IgE is overreactive, causing this person to have the allergic reaction. Type 2 is caused by the IgM. Okay, this IgM, this antibody is overreactive and try to destroy something that is actually not really dangerous. Okay, so they actually causing this problem in our body. Like for example, during the blood transfusion, if someone get the blood from blood that is incompatible, what happens? The IgM will destroy that red blood cell and causing problem in the recipient's body. And then the type 3, this is caused by the most abundant type of immunoglobulin, which is the IgG. So the IgG is really overreactive, sometimes killing our own cell. So many type of autoimmune disease is actually type 3 hypersensitivity, like for example, rheumatoid arthritis or RA, the IgG actually killing our joint cell. Another example is the type 1 diabetes, which is the IgG killing the beta cells in the pancreas. Okay, that's the type 3 hypersensitivity. Type 4 hypersensitivity, this is the only one that is caused by the T cell. Example is during the poison ivy, contact dermatitis, and also graft rejection, or maybe organ transplantations. Usually the T cell will try to destroy the foreigner tissue or the foreigner organs. Okay, that's hypersensitivity of the T cell. This is type 4 hypersensitivity. Now we're gonna again discuss one by one. For the underreaction, there are two types: lack of surveillance and immunodeficiency. For the lack of the surveillance, again, the immune system, especially the T cell, is actually do not survey our body, or maybe lazy to perform the surveillance. What happened? It can cause some problem, like for example, cancer. So cancer mostly occurs by the T cell that is not really great in surveying our body. Okay, so just for information, most of our cells have the ability to be cancer cell. We are staying healthy most of the time because the T cell doing their job greatly, surveying the body. But if the T cell unable to survey the body, then the cancer will be developed. So this is underreaction, weaker type of immune system. The second type is loss of immunity, is also known as immunodeficiency. So in this case, the individual actually do not produce the B cell and or the T cell. So it is happening during the childhood. Okay, for example, they born with this condition. That immunodeficiency is called the primary immunodeficiency. Example is a baby that born with the inability to produce B cell and T cell. They usually will die during the childhood because they are actually unable to protect themselves. An example of that disease is called the SCID, severe congenital immunodeficiency disorder. It is very, this individual, these children, most of the time it's really difficult to help because they don't have the ability to fight against infection. The second type is called the secondary immunodeficiency disease. And the very famous example is AIDS. So AIDS is actually acquired after we born, maybe caused by virus, the HIV viruses that attack our T helper. So this immune deficiency is actually caused by the T helper that is being destroyed by the HIV viruses. When the T helper is very low concentration, like under 200 milligram per milliliter or liter, then the AIDS disease will be developed. And these persons, when they already develop in AIDS, usually many of them will die due to the secondary infection. Not because the HIV infection itself, but is because of the secondary infection, like for example, diarrhea, pneumonia, some skin disease will actually kill this individual. Because what? Because they don't have the ability to protect against this secondary infection due to lack of the T helper, or maybe lower concentration of the T helper. Remember, we talked that the T helper in the previous lecture, the T helper is really important to activate both the B cell and the T cell. Without the T helper, the B cell will not produce antibodies. Without the T helper, the T cell will not kill the viruses. Okay, so T helper is really important. And this is actually the one that's being attacked by the HIV viruses. Okay, so again, this is the primary immunodeficiency, like maybe B cell and or T cell, maybe just one of them, like no B cell or no T cell, or maybe both of them. If it is like both of the B cell and T cell, the disease is called the severe combined immunodeficiency, or SCID. Right? So both of the B cell and T cell is not present. So this individual, mostly this baby, will have a lot of problems with the infection. Now, this is what happened, like for example, okay, this is some disease, primary immunodeficiency disease, like the Jorno syndrome over here. What happened? This individual actually unable to produce the T cell. So the T cell is not developed in the thymus, is not mature inside the thymus. And what happened? It will not have the ability to fight against some infection, especially viruses. So this person over here that have this disorder mostly will have a lot of problem with the viral infection, flu, for example, pneumonia, some other viral infection is going to be easily attacked to this patient. Another one is if that person unable to produce the B cell over here, okay? So that disease is called the congenital agammaglobulinemia. So what happens, the B cell is the one that produces antibody. And most of the time, antibody, they protect us against some bacterial infection. And what happens if this person do not have the B cell, most of the time, they will have a lot of problem with the bacterial infection. You can imagine for the SCID, okay, the severe combined immunodeficiency, this individual don't have both of this. This means that this individual, this patient will have all type of infections easily. And most of the time, again, they will have a higher mortality rate during their childhood. Secondary immunodeficiency disease, it is damage of the immune system after birth, maybe caused by infection, organic disease, chemotherapy, radiation, and other things. And again, the most common example is AIDS. So this AIDS person is actually, again, their T helper is being targeted by the HIV viruses. If this person does not have the T helper, it means that they actually unable to protect themselves against many type of infection. And again, most of the time, AIDS people, they'll actually die due to the secondary infection, like diarrhea will be very dangerous for them. Pneumonia will be very dangerous to them. Skin cancer is going to be easily developed too this type of person. Okay, the second type of disorder, okay, disorder in immunity is overreaction, or also known as the hypersensitivity. Again, there are 4 types: type 1, type 2, type 3, and type 4. Okay? The type 1 is mostly caused by the IgE. This is also known as an allergy. This is immediate hypersensitivity. This is the IgE that is really, really overreactive. Try to destroy the allergen, like pollen, for example. Pollen itself is not dangerous for us, but the IgE try to remove it, and what happened? It will produce the allergic reaction. So people that have allergy, they usually have a lot of IgE that will cause or will produce the allergic reaction. We will see how it's worked later, okay? The second one is called the type 2 hypersensitivity. This is antibody mediated. Example, it is mostly caused by the IgM. Example is during the blood transfusion. Blood transfusion, and also there is a disease called the ADN, which is the disorder in a newborn, HDN, hemolytic disease, HDN, hemolytic disease of the newborn. This is actually caused by the IgM antibody type of rhesus antibody, RH antibody. Yeah. And then type 3, this is also known as immune complex mediated immunity or hypersensitivity. Again, mostly it's caused by the IgG that is overreactive, and they usually produce a disease called the autoimmune diseases. So most of the autoimmune disease is actually caused by the IgG that is overreactive, and this is type 3 hypersensitivity. So again, type 1, 2, and 3 is caused by the IgE, IgM, IgG. The type 4 is disease, the one that caused by the T cell. Okay? This is the T cell that is really overreactive. Example is during grafting tissue, organ transplantation, including poison ivy. It is actually caused by the T cell hypersensitivity. Okay, we go to type 1, okay, hypersensitive, which is allergy. There are 2 types of allergy, whether atopic or atopy or anaphylaxis. So atopic is a local, chronic, local allergy. The systemic, the anaphylaxis, this is systemic. This is more dangerous because it is going to the system. It may be fatal to that person. Okay, so atopy, local, anaphylaxis, systemic allergy. Now, how this allergy and allergic reaction actually develop? We're gonna look at the picture over here. Okay, so there are 2 stages actually for allergy. The first stage is called the sensitizing dose. This sensitizing dose is different for different people. Sometimes sensitizing dose only takes days, sometimes takes months, sometimes take years. Okay, that's the reason why sometimes people say that I used to don't have the allergy. Why now I have allergy? For a year I don't have a pollen allergy. Why suddenly now I have the allergy? Because what? Because this person actually developed the sensitizing dose for a year. But some people, sometimes within several days, when they move to new place and then they get allergy, within several days. This is also sensitizing dose. So it really depends on the sensitizing dose. that person will develop into what we call the allergy, which is happening during the second stage. It's called the provocative dose. This is the time when the person have the symptom and sign of allergies, like for example, rash, itchy, redness, mucus discharge, okay, runny nose, pain, swelling, difficult breathing, headache, many symptom and sign of allergy. It is actually present during the second stage. It's called the provocative dose. We're gonna look at the picture over here. Okay. Now, again, there are two stages. The left one is the sensitizing dose, and the second one, this is the provocative dose. This is when that person will have sign and symptoms of allergy, okay, during the second stage, which is the provocative dose. Now, during the sensitizing dose, okay, the allergen, for example, let's say this is pollen, okay, so pollen enter into our system, maybe through the respiratory system, through our breathing. It will be trapped by the B cell. So B cell will have the ability to trap some of the allergen. And remember, the T helper will have the ability to recognize this, because this B cell that has the allergens on it will produce the antigen. The allergen itself is now become antigen for the T helper. And the T helper then will give the information to another B cell, which is the plasma B cell, to produce specific antibodies or immunoglobulin. And the specific antibodies that is produced by this allergens antigen produced by this plasma cell due to the allergens antigens will be the IgE. So IgE will be produced a lot. This IgE then will go to special cell, is called the mast cell. The mast cell is sometimes the mast cell also in the form of white blood cell, which is the basophil. So remember, basophil is the cell that reacts against allergens. Okay, let's say this mast cell is actually basophil. This IgE then will attach to this basophil or mast cell. It takes time. So we have a lot of, let's say, a lot of basophil over here in the first dose, first day, only several of them that will bind this IgE. The next day binds again. The next day, some of them bind again, etc. So it takes time, okay, from this first stage, the sensitizing dose, to the second stage over here, the provocative dose. This time, again, maybe days, months, even maybe for some people take years to develop into the second stage, the provocative dose. Now, what happened when that person start to have provocative dose is mean that the B cell, I mean the basophil over here or the mast cell over here, already have a lot of the IgG on it. Almost maybe most of them, maybe 99%, or even maybe close to 100% of the basophil or mast cell now have the IgE on it. So when the pollen enter, then what happens? This pollen will be attached into this IgE instead of into the B cell over here, okay? Because now it's going to be shift the function. The pollen is not really go to the B cell or attached to the B cell. They more likely will be attached into the IgE that is present on the basophil or on the mast cell. No, whenever this mast cell, okay, that have the IgE and attached, okay, have the allergens on it, like pollen in it, this basophil or this mast cell then will produce chemical. This chemical is called the allergy mediators. This is actually chemical. So the mediator that will cause the allergic reaction, many type of them, and the most potent one is called the histamine. It is the reason why if someone have allergy, if you go to the OTC, on the counter medicine, most of the time the allergy medicine will have antihistamine. Why? Because the most potent mediator for allergy is actually histamine. So let's say this is histamine produced, will be delivered by the bloodstream into some organ that will produce the symptom of the allergy, like for example, the eyes, okay, itchy eyes, red eyes, the skin, okay, itchy skin, red skin, the nose, the runny nose, headache over here, and etc. So again, this allergic reaction, sign and symptom, is happening during the second dose. It's called the provocative dose. And again, some people have different time to the from the first dose to the second dose. Okay. Already mentioned about the role of the mast cell or the basophil, which is this is the one that will get the IgE, and mast cell and basophil, they able to produce the chemical that is called as the allergy mediators. Now, okay, again, we already go to this side. This is the mediator over here. We're gonna look the type of chemical mediators that will produce the allergic reaction or symptom. Okay, so example is histamine. This is the most potent one. There is serotonin, leukotriene, especially for asthma people. This is dangerous. Prostaglandin, bradykinin. So these are type of mediators that produced by the mast cell and by the basophil that will cause the symptom of allergy, like rashes, itching, redness, rhinitis, sneezing, diarrhea, shedding chills, and so on. Okay, look at this. Okay, maybe it's easy to look at this picture now. This is the mast cell, or basophil, maybe. Yeah. And again, when they have allergy, the allergen enter, the IgE that present in this mast cell and basophil will attach that allergen. Let's say this is pollen, okay? And then what happened? It will produce the mediators. So this is mediators. Okay, there are several types of them. For example, prostaglandin over here. So prostaglandin can go to our blood and dilate it our blood vessel. This can cause inflammation, redness, swelling. If it is go to the smooth muscle of the respiratory tract, it's actually constrict the bronchioles, constrict the tract. And what happened? Difficult to breathe. If it is going to the nervous system, the nerve cell, it can cause headache. So prostaglandin, it has several action in our body, and it's depend on different organs. So in the blood cell, it will be dilated. If it is respiratory tract, it will be constricted. If it is nervous system, it can cause headache. Other type like histamine, serotonin, bradykinin, all of them can also have actions on the blood smooth muscle, on the blood vessel. It will dilate it and causing this redness, swelling, increase the blood flow in the skin, If it is going to the respiratory tract, the smooth muscle on the tract, whatever, constriction, the same like this one. Okay, it's gonna be difficult to breathe, wheezing, difficulty breathing, coughing over here, and also increase the peristaltic motion of our GI tract. It's causing vomiting, diarrhea. It's go to the secretory cell like tears gland, for example, mucus gland. It will increase the production of tears, may increase the production of liquid mucus, for example. This is okay, the action of these mediators like histamine, serotonin, bradykinin. Now look at this one. It's also produced leukotriene. This is another mediator. And this leukotriene is very dangerous for asthma people because it's going to be constrict more of this bronchioles and bronchus of these lungs in our respiratory tract. And what happened? It's going to be really, really difficult for the asthma people to breathe because of this leukotriene. So this is the mediators that is produced by the mast cell and basophil during the allergic reaction. Then you have this different symptom over here. So if someone have the allergy, they usually take medicine. Most of the time, the medicine have the antihistamine on it. Or if they have asthma, they're going to have different type of medicine that will have this anti or anti-leukotriene, not only antihistamine. So this is important for us to know this in case you have allergy. Then you know what you have to do and you know what is actually working over there. Okay. Again, histamine is the most profusable or the most abundance mediators that produce during allergic reaction. Okay, again, there are two types of allergy, whether atopic or systemic anaphylactic. Okay, anaphylaxis. Anaphylaxis is dangerous because it is systemic. How to diagnose allergy is sometimes if you go to the doctor, they will test using the skin test, put a lot of chemical on your skin, and you have to go back maybe several days. If your skin showing this bubble, okay, bumpy over here, it means that you have the allergy for that certain chemical. Maybe pollen, maybe grass, maybe animal dandruff. The bigger the swelling, the bigger the bumpy, then it means that you have more allergy against that specific chemical. How to prevent us against allergy? The best method is avoiding allergen, but it is difficult. Okay, it is no way that you stay at home forever. You have to go out. And when you go out, what happens? Then you will inhale the pollen, for example, and then you will have allergy. So number one is the best, but is sometimes is not feasible. It cannot be done. Use drug that block the action of the lymphocyte or maybe the action of the mediator. Most of the allergy medicine, they have this antihistamine, blocking the histamine. Or using the desensitization therapy, which is injection of antibodies in order to block the other antibodies. Remember, we have 5 types of antibodies. The antibodies that causing the allergy is IgE. It can be blocked by other antibodies. And this process is called the desensitization. Usually, you're going to have allergic injection. There is also maybe good for your information, honey, especially local honey, can be also done, used for allergic, preventing allergy. So how it's worked, there is a research that has been written into articles, okay, in the journal article, is mentioned that this local honey is actually able to block the attachment of IgE into this mast cell or basophil. Okay, so that's according research using honey, especially local honey. It can prevent us against allergy, especially pollen allergy, because honey is actually made from the flower, and it's local. Then the flower that made into this honey is actually will have the same composition with the pollen that present on that flowers. So it's a local honey is more effective against this local allergy, especially pollen allergy. This is maybe good information for some of you that might have allergy. This is the injections, desensitizations of allergy using the injection. Usually the one that is injected will be the IgG. So instead of binding the IgE over here, when the doctor injecting the IgG, it will bind the allergens. So instead of binding to this, so this allergen, it will be swapped. It will be taken by the IgG. So whenever the allergen is taken, what happens? It will not bind to the IgE in the mast cell or in the basophil. If there is no allergens over here, like pollen, then it will not produce the mediators. Then there will be no symptom or sign of the allergic reaction for that person. So these injections usually have to done several times. It cannot be stay forever in our body. So within maybe 3 months, several months, it will be gone. That person needs another injection. Now the overreaction, number 2, the type 2 hypersensitivity. Again, this is caused by the IgM. So when we do the blood typing, we know there is a antibody A, B, and RH. So when we do the blood typing, we use these 3 types of antibody. This type of antibody is actually all of them is in the class of IgM. So the antibody A, for example, will destroy the antigen A. B will destroy antigen B. Rhesus will be destroying the antigen rhesus. Then you see what happened when we do the blood typing, right? So this one is used for ABO blood type, and this is used for plus positive, negative blood type. Okay, and then what happens if someone receives the blood transfusion based on the ABO and negative positive? If it is not compatible, this IgM, whether antibody A, antibody B, or rhesus antibody, will try to destroy the donor blood. So usually it's going to be dangerous for the recipient if they receive the incompatible blood type. So the patient, the recipient, will have problems. Sometimes it's fatal. Okay. We already talked about this ABO blood type. So if you are type A, it means that you have A antigen. If you type B, you have B antigen. If you AB blood type, then you have both. If you are O blood type, it means that you don't have this antigen over here. Okay, so that's ABO blood type. And we have done this one. Okay, this process, blood typing, we will not talk this again. This is what happened if it is not compatible, then the antibodies will destroy the antigens. Now, this is happening, and it's only during transfusion. It may be happening and during the marriage. So there is a disease called the hemolytic disease of the newborn. This is caused by the incompatibility of blood when two people, husband and wife, get married. If their blood is not compatible, the kids, the babies will have problem. The embryo will have problem. They might die during pregnancy, or they might die stillbirth. Okay, so this is caused by this RH antigens, which is a type of IgM. Okay, the RH. So this is only happening when the mother is negative blood type and the father is positive blood type. What happened? When the father is positive blood type, the baby will carry the blood cell that have the antigen RH in it. So let's say this is the red blood cell of the baby. Because this has the antigens, the RH negative mother, so the negative mother blood type, actually have the ability to produce this antibody. Okay, so RH antibody. So this RH antibody of the mother will destroy the red blood cell of the baby. You can imagine if the red blood cell is destroyed over here, it means that the baby will die. So that's what we call the HDN, hemolytic disease of the newborn. And again, the only scenario, if the female blood type is negative, in the male blood type is positive, it might cause this HDN. Okay, so right now, actually, doctor can protect the female from it by injecting the antibody, okay, to protect the baby from the mother antibodies. Okay, so type 3, this is the one that mostly caused by the IgG. Okay, what happens on that? This is actually happening to when we have something, like for example, antigens enter into our body, the IgG, will try to bind it and making a complex. This complex structure then will mostly go down into specific organs, maybe skin, maybe the heart, maybe joint area, or maybe bone. Whenever they are stay there, what happens? It will actually initiate the neutrophil, give the information to the neutrophil to come to this place. And neutrophil then try to destroy this area. When the neutrophil destroy it, it's also destroying the cell around that place. So this is causing what example? This antibody actually killing our own cell. That's the reason why it is called the autoimmune disease. This immunity, this immune system actually killing our own cell. Okay, so autoimmune disease. There is several organs that mostly have this autoimmune disease, like for example, maybe blood vessel, the heart, joint, bone and the joint, the skin, the kidney, for example. Okay, that's maybe place where this complex will stay and causing the attack by the neutrophil. Type 4 hypersensitivity. This is the only one that caused by the T cell hypersensitivity, overreaction. Example is graft rejection. So if we have skin graft, for example, if it is coming from other people's foreigner skin, then what happens? The TC will try to destroy that foreigner skin. If it is organs transplantation, for example, the T cell will also try to destroy that foreigner organs. Okay, so and this is the reason why, if people have this kind of surgery, doctor will give them the medicines that will protect them from the attack of the T cell. Right? This is another example of the T cell mediated hypersensitivity, like for example, poison ivy, where the antigen enter, it will be try to be removed by the macrophages like the dendritic cell, and then T helper will come. Remember, T helper is the one that recognize the MSC number 2 from macrophages, dendritic cell, some B cell, for example, and then it will give the information to the T cell to kill or to destroy that. So when they destroy it, the T cell produce the toxin to destroy this allergen, for example, poison ivy. They're also destroying the they're also destroying our cell over here. And the macrophages also produce chemical that can induce the inflammation over here. So you're going to see this sign and symptom of the poison ivy because of this process, this hypersensitivity is done by this T cell. Another example of the hypersensitivity type 4 is during the graft or organ transplantation. Again, there will be rejection from our T cell if we receive foreigner skin or foreigner organ. If the skin is coming from ourselves, the T cell will not reject that one. Okay, so the graft that coming from our own cell will not be rejected. Therefore, there are several classes of graft, right? Like first of all, skin graft, autograft. Yeah, the skin actually coming from our own skin. Okay, so the recipient also serves as a donor. There's going to be no rejection. This means that it is successful. If it is isograft, the skin is actually from the identical twin. There will be also most of the time no rejection because the identical twin, they actually have the same markers, proteins on their cell. The MSC number 1 are the same, MSC number 2 also the same. So no rejection. If it is allograft, which is coming from different person, then there will be rejections. Okay. If it is xenograft, it's coming maybe from animal, okay, animal skin, it's going to be the same. There will be rejection. Okay, so the rejection can be minimized by using immunosuppressive drugs. So the doctor will give patient this medicine after their surgery in order to suppress this rejection over here. This is example. Another example is organ transplantation. If the organ that is transplanted is not the bone marrow, like for example this heart, for example, whatever, the host T cell over here will kill the graft, the heart graft. Okay, so this is coming from the donor. So this is the donor heart. It will be destroyed by by this recipient T cell. But if the graft is actually bone marrow, remember bone marrow is the place for blood production. What happened actually, the bone marrow graft, okay, which is donor, will produce the T cell, and this T cell is actually the one that will destroy the host tissue. So this is if different type of organs, especially if it is bone marrow organs transplantation, the T cell from the donor will kill or destroy the host cell. But if it is other organs than the bone marrow, like the heart transplantation over here, the patient or the recipient T cell will try to destroy the foreigner heart and the donor heart. Again, now we're going to talk a little bit about the autoimmune disease. Most of the time, this is type 3, even though some maybe come from the type 2 hypersensitivity, but most of the time, this autoimmune disease is a type 3 hypersensitivity. Example is lupus, RA, MG, myasthenia gravis, multiple sclerosis, MS, and type 1 diabetes. They are examples of autoimmune disease. This is type 1 diabetes. What is actually happening? Remember, our cell in pancreas, especially the beta cell, okay, the beta cell produce the insulin. And in the type 1 diabetes persons, the IgG is actually destroying the beta cell. And the destruction is actually progressive. Okay, this is progressive. It means that maybe during childhood, this individual don't really realize that he has type 1 diabetes until, okay, most of the beta cell being destroyed, then they start to have the symptom and sign of diabetes. So let's say maybe most of the time around 14 years old, that person will start to have the diabetes symptom and sign. Sometime earlier, sometime later than that. It really depends on the life habits of that person. If during childhood he has a lot of sugar eating, for example, it might be before 18 years old, he already get that symptom and sign of diabetes. If they eat healthy, it maybe, that diabetes develop after, 20 or even 30 years old, but it will be there. It will start to give the sign and symptom of diabetes whenever the beta cell, most of the beta cell are destroyed by the IgG. Again, this is autoimmune disease. This is myasthenia gravis, which is our cell, our muscle cell. The patient or the one that have this problem, disease, their muscle is really weak, paralyzed. What happened? So this is during normal. Okay, this is a normal condition. You still remember our motor neuron produce the acetylcholine. Acetylcholine will be released into the synaptic cleft, will be bind by this receptor. When the receptor binding is open the sodium channel, sodium enter into our muscle cell. It will stimulate the opening of calcium channel in the sarcoplasmic reticulum, the SR. Calcium then will be out from the SR, bind to the proteins. Okay, and then the proteins will start to glide one another. Okay, and then start to give contraction. If that person has disease called the myasthenia gravis, what happened? The IgG over here is actually blocking the acetylcholine from attaching to this receptor. So instead of attached to the receptor, the acetylcholine will be attaching into the IgG. And what happens if there is no acetylcholine on the receptor? The sodium channel will not be opening, then there will be no contraction. So that person will have paralysis. Okay, this is the myasthenia gravis, which is a type of autoimmune disease that's caused by the IgG that actually block the muscle contraction. I think that's all. Okay, so we finish in this disorders of immunity. I hope it is helpful and give you more understanding about our immune system. Goodbye.